Okay, let's just dive right into this explainer and explore the really startling, sudden reality of Bell's palsy. I want you to imagine waking up, walking into your bathroom, looking in the mirror, and realizing half of your face literally will not move. It's an absolutely terrifying scenario, right? But today, we're going to break down exactly what's happening, why it happens, and why, honestly, there is actually a whole lot of hope on the other side.
So here's our roadmap for today. We'll start with the sudden shock of it all, then dig into the anatomy of the facial nerve, compare Bell's palsy with a stroke, which is absolutely crucial, and then cover diagnosis, interventions, rehabilitation, eye care, and finally, the road to recovery.
All right, section 1, the sudden shock.
Now, this is the question that instantly flashes through literally anyone's mind. Half your face suddenly freezes, and your absolute darkest fear is, oh no, am I having a stroke? The panic in that exact moment is so real, mainly because the onset happens so incredibly fast. We're talking within just a matter of hours.
And what's truly startling is just how many different symptoms hit you all at once. Usually, they peak within about 48 to 72 hours. You've got this sudden weakness or total paralysis on one side of your face. Your mouth starts to droop, kind of pulling toward the healthy side when you try to smile. You might find you literally can't blink or even close your eye. And your forehead? Totally smooth. It just won't wrinkle. On top of that, you might experience drooling, a super dry mouth, altered taste, ear pain, and even this weird heightened sensitivity to sound. Oh, and people often feel like their face is totally numb, but actually, scratch that, it's usually just a sensation rather than a true loss of sensory feeling.
Moving right along to section 2, anatomy of the facial nerve.
Okay, so here's the crucial thing to understand. It's not that your facial muscles are broken or damaged. They are fine. It's actually the communication cable controlling them that's been compromised. Bell's palsy is caused by inflammation, swelling, or compression of the facial nerve. You might hear it called the seventh cranial nerve. So think of it like a pinched wire. When this nerve swells up, the signals from your brain simply cannot get through to the muscles.
And this pinched wire concept perfectly explains why patients get such a massive, bizarre range of symptoms. I mean, think about everything this single nerve handles. It controls your facial expressions, right? Smiling, frowning, blinking, raising those eyebrows. But it also processes taste on the front 2/3 of your tongue. Plus, it controls your tear production and your saliva production. Because this one single nerve does so much more than just movement, a single pinch point throws the whole system out of whack, leading to dry eyes, dry mouth, and, yeah, losing your sense of taste.
So what actually causes that pinch? Well, honestly, the exact cause isn't always 100% clear, but it's widely believed to be tied to viral infections that trigger the nerve to swell. We're talking about everyday viruses, things like the herpes simplex virus, influenza, or Epstein-Barr. Then there are other risk factors that put stress on your body or immune system. Diabetes, pregnancy, or even just having a recent upper respiratory illness can trigger that inflammation leading to paralysis. But, and this is super important to remember, Bell's palsy itself is completely non-contagious.
All right, section 3, Bell's palsy versus stroke.
Listen up, because this is arguably the single most important part of this entire explainer. Understanding this difference could literally save a life. The major key lies right in the forehead and then the rest of the body. With Bell's palsy, the entire side of the face is affected. That means the forehead is paralyzed, it cannot wrinkle. A stroke, however, usually spares those forehead muscles, so someone having a stroke might actually still be able to wrinkle their forehead. Plus, a stroke might bring on arm or leg weakness or slurred speech, whereas Bell's palsy typically doesn't. If you notice spared forehead muscles, weak arms, or slurred speech, that is a stroke. It's a massive medical emergency, and you need to get help immediately.
Now, who actually gets Bell's palsy? Our data here is pretty clear-cut. Unlike a lot of conditions that heavily skew toward one demographic or another, Bell's palsy totally doesn't discriminate by gender. It affects men and women completely equally, a perfect 50-50 split.
And as for age, it mostly strikes folks in the 15 to 60 bracket. But keep in mind, it can definitely still happen to kids and older adults too. Really, almost anyone at almost any time could experience this sudden nerve inflammation.
Moving into section 4, diagnosis and interventions.
So how do doctors figure this out? They rely mostly on a clinical exam. They're going to check your medical history, do a neurological exam, and really test out those facial muscles. Big scans, MRIs, CTs, or blood tests, those are really only pulled out if they absolutely need to rule out other issues. Now, because jumping on this early makes a huge difference in recovery, doctors will usually be pretty quick to prescribe corticosteroids, like pregnenolone, to aggressively knock down the swelling on that trapped nerve. And if they suspect a virus triggered the whole thing, they might throw in antiviral meds like acyclovir or valacyclovir, too. Obviously, all under strict medical supervision. Next up is Section 5, Rehabilitation and Eye Care. Okay, this step is incredibly urgent and totally actionable because the patient literally cannot blink or fully close their drooping eyelid. Their eye is just sitting there, entirely exposed. Immediate eye protection is absolutely critical. We're talking artificial tears, thick lubricating ointments, wearing sunglasses, and physically taping or patching the eye shut. You have to do this to prevent severe permanent damage to the cornea from it just drying out. Once that acute protection phase is handled, physiotherapy steps in to save the day, helping to restore both function and confidence. The goal is to build back muscle strength, get that facial symmetry back, and keep things from getting stiff. Physiotherapist will guide patients through specific steps. First, basic facial exercises, so practicing your smile, pursing your lips, puffing out your cheeks. Then there's mirror therapy, which is this totally fascinating neuromuscular retraining trick that helps your brain literally reconnect with your face. And finally, some gentle facial massage and relaxation techniques to keep the muscles nice and pliable.
And finally, Section 6, the road to recovery.
I have to say, this timeline is incredibly reassuring. Yes, the onset is brutal. It happens in mere hours and peaks within about 48 to 72 hours. But let's look at the recovery end of things. Most mild cases, they see full, complete recovery in just a few weeks. Moderate cases usually bounce back within 3 to 6 months. Sure, severe cases might take a bit longer, but the vast majority of patients recover completely. And younger patients especially tend to bounce back even faster.
Now, we do need to be real and mention some potential complications if the recovery isn't quite 100%. Aside from things like chronic dry eye or tight facial muscles, a major one is something called synchisis. Basically, this is a condition where the nerve wires kind of get crossed while they're healing. It causes these unwanted automatic facial movements. So, for example, your eye might suddenly close when you're just trying to smile. That's exactly why sticking to that physical therapy routine we just talked about is so absolutely crucial.
To wrap up that thought, our source has this quote that perfectly encapsulates the reality of Bell's palsy. The condition is utterly terrifying at first glance, right? I mean, it strips away your ability to express emotion, taste your food, and even just close your eyes. But it's also highly treatable, totally manageable, and in the overwhelming majority of cases, temporary. Spotting the symptoms early and getting immediate medical attention is really the secret to greatly improving your chances of a full recovery.
So I'm going to leave you with this final thought. We've explored the sudden shock of it all, that pinched, trapped nerve, and the very hopeful road back to a normal smile. But if this happens tomorrow to someone you love, will you remember what to check for on their forehead to literally save their life? Keep this knowledge in your back pocket. It might just make all the difference in the world.